Welcome to the ARMS Coalition Weekly Update, keeping the community informed on COVID-19. My name is Kimberly Dull. I'm with Novant Health Community Engagement, and I'm here today with Dr. Pamela Johnson, a pediatrician at Novant Health Waverly Pediatrics and Primary Care in Charlotte. We're going to answer your top 5 questions that you're asking about the COVID-19 virus this week. The first question that we're getting about the vaccine, Dr. Johnson, what are the side effects that we can expect from receiving the vaccine?
Well, first of all, Kimberly, thank you for that introduction. And many people already have some idea of the side effects to be expected. They can have soreness of the arm, they can have warmth of the arm in the place where the injection was done. Sometimes a day or so later, headache, being a little more tired than usual. Those are the major ones. Those are minor, and some people, when they get that second one, have a little more intensity to those side effects. But again, those are very short term and can be relieved if you use things like a cool compress to the arm just to help keeping that arm moving. And after you get your injections, you can certainly use things like Tylenol, ibuprofen, or Aleve. It's not recommended that you take those prior to your vaccinations because sometimes they may affect the way your body responds to the vaccine, and it may affect the immunity.
Got it. That's so helpful to know. And I think it's helpful for us to know what to expect, and that when we have some of those symptoms, that means that the vaccine is working and our immune system is ramping up and it's responding in the way that it should. Question number 2, if you have heart disease, COPD, asthma, or an autoimmune disease, should you get the vaccine?
So the quick answer is absolutely yes. And the reason for that is those conditions actually put you at highest risk for severe response to COVID infection. So you should really be on the forefront of trying to get the vaccine.
Fantastic. Question number 3. We're seeing this a lot from folks who are visiting getvaccinated.org to try and schedule an appointment. They are eligible for the vaccine. They are in groups 1 or 2 and have tried to schedule an appointment through Novant Health. It told them the first available appointment was in May. What is up with that, Dr. Johnson?
So we feel your frustration. Novant Health, we understand it. And so what we recommend and what I recommend to my families is that, number 1, go ahead and schedule that May appointment. But understand that if you go to the website, a couple of times a week, there may be additional time slots, dates, etc. added. One other thing that I tell my families is you don't have to just do one avenue. If you have the ability to register for other places, go ahead and register because there's no telling who will come first. And the more you are on registers, the sooner the possibility that you can get vaccinated. But absolutely, go to getvaccinated.org and check on a routine, regular basis.
Fantastic. And we know new appointments are added as soon as we get those allocations from the state. Typically, those come out on Saturdays. And if you have that May appointment, you can also select to be notified if an earlier appointment becomes available. So just because it looks like May now, it might end up being earlier.
Correct.
Question number 4. We've got Dr. Johnson, who's a pediatrician here. Can children get the vaccine?
So at this point, the lowest age available is 16, and that's through the Pfizer vaccination. Through Moderna, the youngest age is 18. And many families ask me, well, why aren't we giving it to children? The reason is it was never tested initially on children, so we have no safety data. However, that is no longer the case, and we are, both Pfizer and Moderna are working diligently to get children in the research study so that they can then advise lower ages to be vaccinated. I have parents who are asking me how soon my child can get the vaccine. And what I'm saying is we are working on it. And I can promise you, we are working on it as diligently as we can, so that everybody is protected. Because what we also know is that herd immunity is required in order for us to go back to our regular lives. And what that means is at least 85% of the population has to be vaccinated for the illness, for COVID-19, to gradually go into non-existence. So and children are part of that 85%. So as soon as we can, we will start vaccinating. But it has to be done safely.
That is very important. And as we wait to get to that 80 to 85% herd immunity point, Dr. Johnson, knowing that kids can't get vaccinated right now, how can we keep them safe and how can we keep our neighbors safe?
That is probably the most important thing that each of us can do. We need to make sure we mask, and double masking will never be a bad thing. Make sure we wash our hands and make sure we stay socially distanced. One of the misconceptions is that if we have no symptoms, we can't infect people. Well, that is absolutely incorrect, in that those who are asymptomatic, meaning have been exposed but don't have any symptoms, may be the very ones who continue to help COVID-19 spread among other people. So it's really important for each of us to not only protect ourselves, but protect our neighbors, because you never know who in your presence may have an illness that COVID-19 would be deadly for. So that is the one thing that I would stress. Please, please, hand washing, masking, socially distancing. Those are key.
Those are key. That's an excellent note to end on. Thanks for spending a few minutes with us today with Dr. Johnson and I, as we've answered some of your most frequently asked questions. We know there are lots more questions about vaccine safety, effectiveness, and access. A great place for more information, we've mentioned it already here today, is getvaccinated.org. We'll see you next week.